We are live. All right. Good evening, everyone. Welcome to NMA Talks, where we feature the leading physicians and experts in African American health. This program is specifically designed for a non-medical audience and is brought to you by the National Medical Association, a collective voice of African American physicians and the leading force for parity and justice in medicine. So be sure to like and share this video. We are so excited about this topic tonight. For those who don't know me, I'm your host, Dr. Michael G. Knight, at the District Doc on Facebook and Instagram. I'm a board certified internal medicine and obesity medicine physician, and I'm an assistant professor of medicine at the George Washington University in Washington, D.C. I want to welcome our panelists tonight. We have a Dr. Leon McDougall. He is the president-elect of the National Medical Association. He's board certified in family medicine, and he's a professor of family medicine at The Ohio State University, Wexner Medical Center in Columbus, Ohio, where he also serves as Chief Diversity Officer. And you can find him on Twitter at McDougall2020. And we also have Dr. Jan Bray. She is board certified in psychiatry and practices general and forensic psychiatry at West Texas Veterans Health and an Austin private consultation in Austin, Texas. And she's also on Twitter at Dr. Jan Bray, MD.
Thank you.
All right. And we are going to add one more, Dr. Bailey. He's with us as well. And Dr. Bailey is a double certified forensic psychiatrist and the assistant dean of education at UCLA Charles Drew University School of Medicine and chief medical officer of Kedron Community Hospital System. He's a past president of the NMA and chairman of the NMA Cobb Research Institute Board of Trustees. And you can find him on Twitter at Ron K. Bailey, MD. All right, so we already have some folks who are coming in. Let's go right ahead and jump into this topic. Where are we now? We've been dealing with the coronavirus situation for weeks now, and today we're at 2.7 million people worldwide being infected, with 864,000 in the United States, and deaths in the United States approaching 50,000. States are starting to plan reopenings, and we've heard about Georgia, which plans to open businesses such as nail salons and barbershops tomorrow. However, while we focus a lot on physical health, we haven't spent as much time talking about the mental health effects of this pandemic. And so that's why we wanted to bring this expert panel tonight, and we're going to go right into questions. If you have comments and questions, please jump in the comments and put some questions, and we'll get to them as soon as we finish our initial questions. So let's start with Dr. McDougall. The National Medical Association has been advocating for the African American community, which has been disproportionately affected by the COVID-19 pandemic. While we focused on physical health, what are the mental health concerns that need to be addressed in our community?
So I would thank you, Dr. Michael Knight, for convening this panel this evening to address this very vital topic. And in regards to what's needed, I would say having access to culturally competent mental health providers to provide that guidance and recommendation from a trusted source, and be able to listen and be a part of that decision making. What we find sometimes when African Americans and people of color engage European American healthcare providers, that initial discussion is more dominated by the provider without providing an opportunity, more of an opportunity for that patient to speak their piece. And when that type of dynamic takes place, it's less likely that a therapeutic relationship would be developed, and thereby making it less likely that the person is going to follow through with the recommendations. Also, in the African American community, there's a strong spirituality component involved with many of the persons that I see in my practice in family medicine. I say about over 90% of my patients are African American. So you also have to be able to incorporate that belief system into the care and negotiation and developing of a therapeutic plan. And yes, Black males do get depression. So being an African American male physician, I think sometimes that diagnosis is somewhat overlooked in regards to African American and males, and especially what comes up in my discussions. I'm on the front line, so the psychiatrist on the chat here today, what happens is racism is brought up a lot, and I don't think that discussion takes place when the provider is European American. I think just from me first, listening to them, finding out what's going on in their life beyond the chief complaint, because the chief complaint is almost never a mental health complaint from a primary care provider.
Right. And Dr. McDougall, we know that mental health has been such a challenge and sometimes a stigma in our community, and sometimes we don't want to talk about. And I think you've highlighted how even in the primary care setting, we see that. But one of the things we want to do, I'm going to switch quickly to Dr. Bailey. Uncertainty can be tough, right? But financial insecurity, personal and family health risks, and ever-changing recommendations are overwhelming for so many people. At this point in the pandemic, many people have family members that may have passed away alone and not being able to be with them. So how can people even begin to cope during these uncertain times?
Oh, well, thank you, Michael, for including me. I certainly happy to be on a panel with Dr. Bray and upcoming President Dr. McDougall. Issues that I think we're all already challenged to address. Increasingly, we're really striving in psychiatry to find more effective strategies. I kind of think of 3 or 4 things I'm kind of sharing with my clinical patients, and I think what other groups we're talking about increasingly now. I think one, this is a challenge, this COVID-19 crisis, in part because it's infinite, it's really unending. That's kind of part of the problem. People don't really know how to plan because the uncertainty, I think, is much more problematic than otherwise. That probably leads to increased anxiety, even for those who didn't have a baseline anxiety-based type problem, which many of our patients do have. So finding ways to, I think, figure out ways to find out what your current activity matters. So I'll give the example of my mother a lot. She enjoys thoroughly going to church on Sunday. She enjoys going to her monthly sorority meetings. She tutors kids and does those kind of activities. Rather than stopping all of that, she's actually upgraded her technology, learned to kind of do a fair amount of it like we're doing today, using Zoom type technology. And that allows for some better connectedness. And she's kind of continuing activities that probably was beneficial to her, as I think they were to others. We strongly recommend that. I think a second issue, obviously, though, is I think that there's some value in education and for it to be correct. I think misinformation, as Leon just mentioned, is to the detriment, I think, of our people. So knowing what really does work and what will keep you safe, hand hygiene, disinfecting surfaces, knowing when to wear a mask, when not to wear a mask, where to go that's reasonably safe is helpful, rather than thinking that you always are at some risk and some unending risk that you really can't ever get away from. That leads to an unreadiness that I think is problematic, I think, for all of us, especially patients who may have some pre-existing psychiatric sequelae. But the third thing I'd say is I think it's also key to find some outlet, whether a person historically would garden and do things outside, find ways to continue to do the things that were as beneficial to you as otherwise is being told that you can't do your regular activities. I think that's so problematic for many, and very often that keeps families apart and friends from doing the things that I think are of great utility and value to them. My final point, I think, is this idea that we have to, I think, use the groups and activities that have been historically beneficial to us, like the NMA. I'm a psychiatrist, AP, and otherwise, but also reach out to bigger groups. See, the World Health Organization has great information on their website. Other people who I think are information oriented may look at the APA or the CDC. They actually speak to us in ways that we understand our history. We understand, I think, what we're going to need to do to kind of move forward. all issues that I think at the macro level are very important, but at the micro level are essential to keep individuals feeling safe and with decreased anxiety and complication.
Thank you, Dr. Bailey. Let's quickly go to Dr. Bray, and I want to bring you in here because, like Dr. Bailey was mentioning, we know that some people already have diagnosed conditions and some people don't, and they're starting to feel like they've never felt before. You know, social distancing has been shown to flatten the curve in the COVID-19 pandemic, but many people are feeling isolated from family and friends, and may even be experiencing strong feelings that they've never had before. Is there a risk for the development or worsening of mental health conditions like depression or anxiety during this time?
Well, you know, and Michael, thank you for inviting me on the panel, and it's nice to be able to chime in, I think, in terms of mental health and in terms of what's going on with this COVID-19 issue. The idea of social distancing, basically, it tells us not to interact with anyone outside of our household. And it tells us to limit trips to places that we might interact with others and only leave home for essential trips. And so it leaves us with a very huge sense of what to do. We're very isolated. I think in terms of looking at a few examples, look at the folks that actually are single and living alone. They cannot interact with other people, and so they miss that human contact. Look at folks that are single parents, for instance, and they now are homeschooling in March, and it's been already 6 weeks now, and that's a huge stress. It's whether they work or don't work. And then we look at folks that are confined to interact with only their families, and we know that sometimes there are issues and conflict within families. And so that sometimes is an increased pressure when we are confined. And so you look at these issues and you realize there's loss. We've lost our freedom. And in addition, we lose people and we're not able to collectively grieve. And so you also look at collectively the issue of fear. I mean, we're actually facing a virus that is highly contagious, and we don't know if we're contaminated, if we have the virus. There is no testing, and there are people that are actually losing their lives, and we can't predict who that is. I mean, just today, I lost a good friend of mine that I grew up with, I've known for over 50 years, and we've lost through, you know, information that I've gathered today from my hometown. And so we don't know who will lose, and we are not afforded that opportunity to grieve together. And then we have this uncertainty. We don't know when we will be able to actually reverse the current situation we're in. And so when you think about those things, you think about loss, and you think about fear, and you think about that uncertainty. Yes, for sure. I think we are looking at the risk of a large degree of our population at risk for developing a depression. I mean, it's been already over 6 weeks. Mm-hmm. And so when we think about depression, we think about symptoms that occur all day, every day for at least 2 weeks. And so you have to look at, well, let's look at ourselves and say, well, do we have sadness in terms of those losses? Do we have a sense of hopelessness? Have our sleeping patterns changed? Are we eating everything? Or, you know, are we constantly in the refrigerator? Are we eating nothing? You know, are we just not able to concentrate? We have so much time, or are we just not able to get anything done despite the amount of time we have? We, you know, have to really look at these things and ask ourselves, you know, are these things occurring and it's all day, every day for at least 2 weeks, and we are so isolated that, yes, I think we do need to be concerned about those folks that are continually isolated and they can't get in touch with mental health providers, and wondering who is falling along the wayside in terms of depression. It's interesting, and when we think about race and we think about folks that have been traumatized, and I work with veterans, and there's a lot of trauma that I see in that population. Interestingly, when there are situations like this where there's a lot of chaos and a lot of concern, there are some folks that have had traumatic experiences that you don't really see the symptoms of the illness portraying itself. And so there are some people where social isolation is welcomed. And there are some people that have been traumatized from jail or from police brutality or from physical assaults and rape that feel that, well, everybody else now understands the chaos and the deprivation that I've been feeling all along. And so sometimes those symptoms are not actually being realized. But I think the one thing that we have to think about in those folks that have been traumatized and thinking about depression, you wonder if the folks that are out and really want to go to work, to your point, Dr. McKnight, those people that are willing to expose themselves at this point, knowing the high number of folks that are dropping, the high death rate and the virility of this virus, are they actually depressed and suicidal in terms of, the folks that are really wanting to get out there and provide non-essential services? And so it's something to look for, and it's something to look at in terms of how this epidemic or pandemic is really affecting mental health and mental illness. And so I think, yes, I think we are at risk for those people that have mental illness, mental health issues currently, and those people that are feeling things they've never felt before. I think it's really important to recognize what is going on right now.
Right. So let's start. Thank you so much for that, Dr. Bray. I think you really outlined, what people are dealing with, particularly who may have not had the effects of a trauma in the past that are now resurfacing. And so let's start going to some questions from the audience. So please put your questions down in the comment. We're going to do quick responses so we can get as many questions as possible. So I'm going to ask the panelists to give me about 40, 60 seconds max in your responses. So let's start right here. I'm going to start with you, Dr. Bailey. And there's a question here from Ms. Fair, and she says, as a psychologist, I'm concerned about the psychological impact of COVID-19. How can we ensure that mental health is included in the conversation? So particularly when we hear about legislation or just thinking about access to healthcare, how can we make sure that mental health is a part of that?
Well, thank you very much for the question. Dr. Fair may not know, but I'm actually on the APA board now, and very happy to have the opportunity to have a seat at the table and to really try to work diligently to do exactly that, to ensure that the APA's voice is heard. At the APA, very often also partners with other medical organizations, particularly including the AMA and others, to ensure that psychiatry remains at the table. A few things. I mean, one of the first things we talk about a lot now is trying to continue after COVID crisis at some point ends or dissipates to some extent many of the changes that have been operationally effective. Now, in many places, you can go and practice medicine with a license in any state. You don't have to get another state reciprocity type license. In many places now, you can do phone psychotherapy. We've asked for that for years. Now, increasingly, you can actually see patients and maybe not have that 1 week deadline of master treatment plans, because the goal is to get the work done, get the patient seen, especially in settings like mine where we actually are losing staff. I lost about 11 staff due to having a quarantine after testing positive. So we're doing more because our hospital is full with fewer overall staff members. So one of the big issues, of course, is to continue post the COVID crisis once we move on to the next issue that's on the front page of the media's agenda, and to make sure that these opportunities for psychiatry and mental professionals to provide care are maintained. Another thing, though, I think is that we always address the issue of stigma in psychiatry. As African psychiatrists, the good Dr. Bray there and myself have been fighting this battle for many, many years. We have to always, I think, talk about it, emphasize it, and be repetitive messaging, make the point to all, including other African-American physicians like yourselves, who are not psychiatrists, other professionals who are not physicians, and lay people, that you should think about psychiatry first, not as a secondary concern after all the medical issues are kind of worked through, because very often the psychiatric issues precede and give us a signal of what medical complications chronically are likely to be problematic and lead to more morbidity, I think, in patients, even unfortunately unwarranted death. The third and final point, I think, is when we really think about the big issues for people, the issue of grief, which Dr. Bray mentioned, is very, very clear. The fear of not being able at the end to go and see a relative in a hospital, or when somebody's actually you can't go to the funeral, are huge concerns that I think should help us ensure that we remember these issues and not allow the consideration of stigma to push psychiatry, I think, off of the table of concern. Huge concerns for us going forward, and it's a big time for psychiatry to ensure that our voice is heard actively, especially in the Black community.
All right, we have another question here. I'm going to give this to Dr. Bray. This is from Fiona. She wants to know, what are suggestions for the mental health aspect of dealing with COVID-19, individuals who have phobias, etc.? So maybe people who had things that they were managing on their own, but now it seemed to become larger of an issue.
Well, I think it makes me think about a pandemic that happened many years ago, and in the words of FDR, and it helps us with some healthy optimism. And he said that there's no unsolvable problem, and we really do need to face things. If we face them wisely and courageously, that there are things that we can do to help, but we can't do it by simply just talking about it. We must act, and we must act quickly. And so those people that have phobias, they're are prime targets for increasing the issues that they struggle with on a daily basis. And this is a huge issue. And so I think it's really important to get details and get the facts about this virus. Learn what you can do and learn what is out of your control. I think sometimes the level of anxiety gets huge because we take on too much and we try to project into the future. But I think one of the biggest things is to deal with today. Do what we can today. Stay focused on the reality of today. Do as much as you can for yourself today. Problem solve for today. And one of the biggest things that we could do is to reach out to others and for sure own what we're feeling. When we talk about stigma and we talk about the embarrassment of the way we feel and feeling that we're all alone, I think that's one of the things that is really important right now with what's going on, is to own it and to verbalize it to others. And in verbalizing it to others, it allows us to reach out to others, and that gives us some comfort. And once we do that, I think we do need to realize that no matter how long the night, morning always comes.
Mm-hmm. Thank you so much for that, Dr. Bray. We have another question here, and I'm going to bring in Dr. McDougall. Because many folks go to their primary care physician with these complaints at the first stop. A lot of times the primary care physician is the one that has a relationship, and they may not be connected to mental health. So I have a question here from Paz. What are some strategies to find a mental health provider to help deal with depression, anxiety, especially during COVID-19? So you have a patient who's come into your family practice office, they're not dealing well. How can you connect them with care?
So at the Ohio State University Wexner Medical Center, I'm actually part of a patient-centered medical home, and we have embedded psychologists in our family medicine department, and one of them happens to be African American, and it just really makes it a lot easier and addresses some of that stigma that Dr. Bailey was speaking to. Is a very smooth handoff in putting together one's primary care office and practice to have that relationship where that person is right down the hallway. We also have a family physician who is double boarded in psychiatry and family medicine, and I go to him with complex patients in regards to medication management. And so now beyond that, I would turn towards looking at resources through the National Medical Association, and also cultural Black psychologist organization to try to identify culturally competent providers who have a good track record of providing service in the African American community.
Thank you so much. We have another question here from Davon. I'm going to send this to you, Dr. Bailey. Seeing so many patients die working on the front lines, is it okay to emotionally detach for mental self-preservation? And if so, do you have any suggestions how to emotionally detach?
Yes, timely. I mean, all these questions are excellent, and this is certainly right in that category. Literally today, I had an employee reach out to me who didn't take the time off a month ago that we offered at my hospital, where you could actually go home with no reason, just because you were uncertain you could handle it emotionally, at 75% pay. Or if you had a reason you couldn't stay because you over age 65, or if you were on a immunosuppressant medication, or if you were pregnant, or if you had older relatives to take care of, or children in school, you could go home at 100% pay. This person did not take that and continued to work and has been with us for a month. And now emotionally, not sick, testing negative, we tested everybody in my hospital, but emotionally probably can't continue. Very important to recognize, I think, the huge emotional burden for caregivers and caretakers in these settings. Data shows very clearly African Americans are at the front of that list, more so in these healthcare type roles or jobs, or even in other kind of service industry where you have close contact with people who at some point, as I think has been mentioned by both the other speakers, may get ill and may fall ill and may have an adverse outcome. I think a few things are key to emotionally detach. One, it may be extreme to have to stop going to work every day and being in that setting, like this employee. Some people may actually go and take more breaks and move to a different role. I'm a psychiatrist in a psych hospital. We do rounds every day, and now we do something I've never done in my life. We're around where the doctor is in the room with the patient and the nurse, and the social worker, the psychologist, the OT, and the case manager, all in their offices, zooming in. They're in the hospital, but they're zooming in. So you don't have 6 people in a room as usual. You really have 2. It promotes social distancing, but also just decreases the likelihood that all 40 other people have to be on a unit, let alone next to the patient during that period of time. Because in my hospital, all the staff is wearing gloves and masks, but not the patients. I think a third thing is also key. You have to kind of decrease the timing. I mean, I, like all 3 of you, have been kind of high energy, high work, high intensity my whole career. I'm kind of taking days, not off, but where I leave in the middle of the day more, where I'm showing up at 10 and not 7 as I had most of my career. So my total volume of time in the hospital is remarkably decreased as it has been the entirety of my life, although I work at the hospital every day. Those kinds of things, I think, decrease the emotional burden that's on our patients and on staff, as well as a physiological one, because the more time you're there, the more risk that you actually have. Key issues I think that someone should do if you're going to try to pace yourself, not get ill physically, but also not get overwhelmed psychologically and emotionally.
Thank you so much, Dr. Bailey. We have a question here from Karen. I'm going to send this to Dr. Bray. What would you suggest for a person who is COVID positive, who is giving up hope of recovering?
I think it's important to be in reality. I think in terms of being COVID positive, I think is to take an inventory of what is actually happening in terms of your organ systems, in terms of your mental health, and be in the now. I think it is very difficult. It's very difficult to maintain a sense of being positive, but I do know that it's very important to be optimistic. There is a need to get information. I think there is information everywhere regarding COVID, and I also think that healthy practices are absolutely important, not only if you're testing positive for COVID, but if you are just simply living through this pandemic. I think in focusing on what is healthy, I think we all can, if we don't know what to do that are healthy habits, then we have so many things available to us. Google it, Bing it. We do need to maintain a sense of having to do what we need to do to empower ourselves to be the best that we can be. We need to work on being our best selves, there are so many things that are out of our control, but having the resilience and having that ability to fight for yourself, I think is really important. There, of course, are a myriad of issues that cause people to want to give up. But I think also it's important, reach out to others. Let someone know that you are just feeling hopeless and helpless. Reaching out to others, I think, also helps you own it. I think it helps you feel empowered. It helps you feel that you're not so alone. And it also helps other people feel that you are willing to share with them. I think in addition to being in reality, in addition to being your best self, I think reaching out to others is something that can also add to your level of resilience. And so, no, we are not all powerful, and we do not know what will happen in terms of our being infected with COVID or when we test positive. But those are the three things that we could do. Reach out to others, do as much as you can to maintain a sense of healthy habits, get your sleep, drink water, have healthy eating habits, and reach out to other people in order to give you emotional strength and help you with resilience. And so I think it's also important to sometimes just be still and know.
Thank you so much, Dr. Bray. We are running out of time, but I want to sneak in just one or two more questions. We have a question here that's come in. I'm going to ask Dr. Bailey to respond to this one. There are many children who are feeling a sense of loss. They're missing friends, significant events, and grieving. We know they're resilient, but what are some concrete things we can do to help them feel safe? And how do we assure them that everything is okay when we as parents don't even know?
Children are a huge challenge, I think, for all of us, whenever these type of stressor, disaster-related issues, I think, come into play. And there's about 4 points that we talk about a fair amount that I think are very relevant in this setting. One, you've got to talk with your child, and it's more important, you've got to listen to them and hear them over time, how their thoughts about what's actually happening impacts them. Children are people too, not just little adults, and they have thoughts that grow and evolve. And I think at times we may miss that and not think that those conversations have legs and that they grow and evolve. I think that's actually very key. Now, more than any other time, is essential to, I think, to really double down on that and give it, I think, the time that it deserves. I think, secondly, children are very much at risk, like adults at times, particularly so, of having misinformation and being afraid. One thing they're often afraid of is they're going to lose you. Their adult, their caretaker, the one who loves and meets their basic needs. They've got to hear and be reassured both in what you do and in what you say that you're going to be fine, that you're probably practicing good, healthy habits and practices in what you eat and what you drink and that you're on your medications. I think Dr. Bray said correctly. I think that's essential because children very often will see what's going on and deduce much more than that than very often parents may appreciate. Huge issues and how you interface with them, that you promote, I think, a sense of safety and strength and comfort. I think a third issue also is that children, they're routine oriented. So when their routines change, they struggle with it much more so very often than many of us. And many of us as adults have great difficulty. So trying to maintain some semblance of a routine that matters to them, that they can depend on and believe in, I think is essential for a parent to make a child feel safe, decrease their anxiety, and decrease kind of acting out behavior we often see in child psychiatry that occurs when a child, I think, has great unreadiness and is uncomfortable, I think, in their local setting. The final point, I think, clearly is we should be very acutely aware of small changes in children's lives or behavior action and take them pretty seriously. And if so, seek professional help. I think earlier is always better if needed.
Thank you so much, Dr. Bailey. We're going to wrap. We have one more question we're going to pull in here. We have this from Eldon. I'll have Dr. Bray answer this one. Since interaction with art, music, and theater is a part of African-American culture, how has this disconnection from the arts affected our mental health or other experiences that may be culturally significant?
I think it's a huge piece of what has developed within us as a sense of community. I think culturally, as we develop, we learn very early on, and we develop a kinship to different styles of music that actually it becomes familiar to us throughout our development. I think music is also something that is soothing and healing as we become adults. And I think it's something that is a universal language. And so when we develop issues in terms of depression, in terms of cognitive issues, and dementia, I think there is a universality of music that allows people to continue to grow and to continue to tap into those levels of their central nervous system. And it continues to help them feel that they're a part of what is going on. It continues to help them feel vibrant, even if you lose your ability to verbally communicate, even if you lose your ability to feel connected to your family or to your childhood. I think there are parts of our brain that is so activated by music, from whether we're children or whether it's in our adult lives, or even as we develop issues as we get older. I think music has a huge role to play in terms of how we can use it and what we can do with it, in terms of soothing, in terms of what we can do to maintain a healthy perspective when it comes to mental health. And so I think it's a huge piece of what we can do to maintain mental health. Culturally, I think it's a very valuable tool that we can all use.
No, definitely. And I think virtually we see so many opportunities now for concerts and interaction with artists and hearing music and arts in ways that we couldn't from our own home. So looking for those opportunities, I think Dr. Bray would agree, are really helpful. Well, we've come to the conclusion of our program. I'm sorry we haven't gotten to all the questions, but check the chat box a little bit later, because we often will go in and put some text comments to some of the questions that come in. This video is going to be on our Facebook site, so please share it with friends. This is a conversation that we have to have in the African American community, particularly at this time, and the National Medical Association is taking the leadership in getting this information out there. So thank you for joining us for NMA Talks. A special thank you to our guest, our NMA President-elect, Dr. McDougall. He's sitting in today for Dr. Brooks, so we appreciate him joining with us. Dr. Bailey and Dr. Bray. Our producer, Dr. Shanda Hosley, is in the background. Please follow and connect with us at National Med ASSN, where you can find recordings of this and previous NMA Talk programs to share with your networks. You can email us at nmatalks@gmail.com with questions or comments. Be sure to join us for future programming. I'm Dr. Michael G. Knight. Again, thanks for coming, and we hope you have a good night.
Mike Knight, you good, man.
Thank you.
You're good.
Good night, everyone.
Good night, guys. Good night.
Thanks, everybody.